Now I have to shift my gears as well because my guest is there from Minnesota Adler Graduate School, Mr. Greg Balfany. And I will take him on board in a while. And I'm expecting some international audience as well. So I will be there with Mr. Greg while talking about art therapy. Here is Mr. Greg Balfany. A very warm welcome to you, Mr. Greg, to House of Wellness and our program on art therapy.
Thank you, Yasir. It's an honor to be here, to be sharing this information and to be connecting on an international level, talking about art therapy.
Yes, and I assure you that the eagerness and enthusiasm with which our audience will be there, looking forward to those insights which you will be imparting in due course, because art therapy, it sounds very exciting. And I know that the practitioners and the graduates of psychology, they take fancy to this very therapeutic intervention, but we don't know much about it. At least I don't know much about it other than maybe reading a couple of articles on it. So we look forward to know a bit more about it and to add that knowledge to our existing understanding of psychology in general and therapy in particular.
All right.
So moving on, Craig, I would like to ask a couple of general questions, and then we will go a bit deeper into the correlates and the constructs of art therapy. And I would like to take a few questions from the audience as well. So my first question, and it is a very informal question. When we talk about Adler, I know Adler as a personality theorist and a personality psychologist, and that's all. I mean, we did study about him and his theory of personality, but when it comes to therapy, in the presence of Carl Roger and Jung and Freud and whatnot, where do you place Adler when it comes to clinical interventions and therapeutic interventions as a particular subdomain of psychology?
Okay. Well, with Alfred Adler, he seems to be very often misunderstood in the broader psychology practice and field. If we go back historically, he was a contemporary of Freud. He was involved with the formation of the Viennese Psychoanalytic Society. And back in about 1902, and then by about 1912, he split off from Freud because he developed his own kind of theories about the personality. He didn't want to see it as split into three separate sections. He saw it as humans as being very holistic. It's the whole body, the whole sense of the personality. And so that evolved into what is referred to as individual psychology. Now, often, with individual psychology, people misperceive that as just focusing on the individual. But because he was a German-speaking man of origin, his initial words were indivisible, not divided. So you translate that German accent, and you hear that not much difference between individual and indivisible. So the individual word stuck and not the indivisible piece. So that's kind of where the individual psychology comes from. So
okay.
With that, he's really focused on, his theory is about the humans have this drive to be creative, they have the skills of being intelligent, and they can determine their own lives, their own course. They're not waiting around for the environment to act upon them. They have this determination to pursue that. And Adler's approach is very strength-based. It's not about pathologizing. It's not about this is what's wrong with you. and we need to fix this. And seeing how people live their lives, their movement through life, helps us understand some of their mistaken beliefs, some of their problems in their lives, in their relationships, in their careers, in their views of the world. So understanding their lifestyle is kind of the assessment that an Adlerian would do. We can help create some insight and some movement to create change in their lives in a very strength-based, very positive psychology-based. There's cognitive components to this about changing their behavior. So it's very applicable, and his work influenced cognitive psychology, humanistic psychology, his work in psychodynamics, and Gestalt with holism. So he had lots of influences across the psychology developments, and oftentimes he doesn't receive a lot of credit for that because he died right before World War II, and a lot of the analysts in Europe came to the United States, but they had the Freudian piece, so that's why it has that stronger foothold in the U.S.
Good to know. It's a very holistic and informative overview of Adler's footprint in the psychological interventions. Now, Mr. Craig, my next question to you is related to your personal endeavors. What brought you to art therapy? I believe 15, 20 years ago, when you were starting off your career, there must be a good number of candidates in terms of therapeutic approaches you could have your expertise in. What made you choose art therapy as your forte?
Well, that is an interesting journey. For if I think back as a young kid, and again, these early life experiences are very formative for us. And I always enjoyed doing art, making art, being creative, kind of using my hands to create. But also I was very much very empathic, very much into wanting to help others. My initial career aspects were around going into medicine. And when I was in my early years of college, I was working in the art department, helping in the studio, studying a lot of science at the same time, but realized that something was missing. And I just stumbled across a little brochure about art therapy that tied in the art and the therapeutic helping aspects. And that was it. That was the light bulb. And I knew that was the path I needed to go. And it's so interesting because when I interview my potential applicants to the program and I listen to their story, I hear a very similar story of how they came into art therapy. And that's been my passion for the last 30 years.
Okay, good to know. So, Mr. Craig, what is the overall efficacy of art therapy? What do you think that which kind of particular psychological ailments and disorders are more likely to be treated with the help of art therapy more effectively as compared to other interventions?
Okay, I think with this, to create a foundation for us, I'm going to go in a couple of images to help maybe give some background, and I can build from there. So I'm going to share my screen here.
Sure.
So just to give a little context in terms of art therapy in relationship to verbal psychotherapy. You have the therapist on one side, you have the client, participant on the other side. You have that dialogue, the back and forth conversation, primarily in the verbal context, this exchange back and forth. Again, creating that whole safe environment. So if we go to the next slide, please.
Yeah.
And we're going to add art into this relationship.
There you go.
So we have the same relationship, but we're putting art into the middle of this diagram. So you see how you have the therapist responds to the art kind of reflects back on the therapist. The client has the same experience between making the art, how it reflects back to them, but also you have the added dynamic of the relationship between the client, the art, and the therapist, the art, and the client. So we've really expanded the variety of dimensions in which they can kind of relate, have a conversation, or even a nonverbal exchange when you have the art. Oftentimes that art can be a container of really intense, distressing emotions, memories, experiences that are very overwhelming for them. So the art can be a safe space and kind of an anchor within that relationship. So that can really help build that therapeutic rapport with the therapist and with the client. And it's something that they can go back and reflect on in the future as well.
Do I need to go to next slide?
Yes, let's go to the next slide. So art therapy has different approaches that we can take. And going back to your question about efficacy and where and how it might be most effective, well, it might all depend on what process or how do we engage our clients. So art therapy can be a person-centered approach. So an example of that is, I'm coming to you because I'm struggling with anxiety, perhaps. And so I want to use art therapy to kind of focus on this particular issue or the symptomatic things in my life. And so I'll use the art to maybe explore, an image of anxiety and how we can work with that to make some shifts, to learn some coping skills, some strategies, rechange my thinking and my actions around this experience with this challenging emotion. So that would be a person-centered approach. Another approach would be process. The person-centered is kind of like art psychotherapy. All right, so it's focusing on these dynamics. The process-centered is more like art in therapy, where I might come to a session and I am just enjoying the process of making the art in the relationship with an art therapist is healing and therapeutic in and of itself. It's just messing with the clay, it's painting, it's weaving, it's whatever that media process is. That's just inherent. It helps organize my mind, it helps me focus, it helps me relax and let go of some of my defenses. So as I'm working with my hands, I'm talking and I'm sharing because I'm in a much more relaxed mind state. So that process is very, very important to get into. And we can work in that. And we may not be focused on, our problems at the time, but it allows us just to kind of be relaxed and be very present. And then a lot of those stressors and symptoms just kind of drop away because we were able to find a place that we were grounded and connected. And the third approach could be very product-oriented, where you think of working in maybe a senior with senior citizens, elderly people, and they're in maybe a nursing home, assisted living situation, and they're coming together to make art together. Maybe they're quilting, maybe they're making cards or some kind of product that they're going to sell to raise money for special activities or to contribute to some kind of charity. And so it gives them the sense of, through this product, that they are contributing. They have a sense of belonging, they're working together, they can be social and connected with others so that they're not so isolated. So that product, that focused on that product, it's not about, delving into their past lives and dilemmas and challenges. It's just being right there with them, creating together. So art therapy can take all three of these approaches. And sometimes you can do all three at the same time in a session. So depending on your clients, that's going to depend on the approach that you're going to take.
Okay, good to know, Craig. Now, my question is, after knowing this much about art therapy, is art therapy applicable or I must say more instrumental for a certain age group? As when it comes to art, it means that it is something related to youngsters, kids who are more into, artwork, and they are more adherent to the fancifulness of artwork, or it is for adults as well, and equally effective for adults as well.
Yes, most people do think that of art therapy as being specifically for children, but that is not the case. It expands the whole range of human development. Yes, some children, may gravitate may get into the art making process. They're much more spontaneous, much more relaxed with it. Adults might have some more hesitation to it because of their sense of inadequacy. It's like, oh, I can't draw, people will laugh at me. It kind of goes back to their experiences of maybe art trauma that they've had in school where they've been criticized, or it wasn't good enough, or it doesn't look perfect. So, but we challenge that and we work with them and we encourage them to explore, and they don't have to be artists to do art therapy. You don't have to have those kind of artistic skills or knowledge. That's the skill of the art therapist, to engage them and say, hey, try this, explore with this. Maybe you're not comfortable with drawing, but perhaps you'd enjoy painting better, or play, or building something. Those are ways that we are giving them choices, that giving them a sense of feeling competent and confident in that creative process. And that really, turns on the light and enthusiasm for them when they get into that space.
Now, it brings me to another question, which is very typical question when it comes to gauging the effectiveness of different therapeutic approaches, as it is always attributed to CBT, cognitive behavioral therapy, that a certain level of intellectual or educational background and resources is a must to make CBT work. Now, my question to you is, when it comes to art therapy, because you have to understand certain cultural and socio-demographic aspects of Pakistani society as well, that we do have a problem of illiteracy here. So if we talk about art therapy, how will you rate its effectiveness for an audience or for a client who is be it illiterate or intellectually not as resourceful as so to speak normal person is?
Oh, okay. Yeah, I've done a lot of work with certainly young children, certainly people who've experienced developmental disabilities, traumatic brain injuries. So they have physical limitations, cognitive limitations, and the use of art can engage them in so many ways because it's sensory. They can use their hands or use adaptive equipment, hand sticks, mouth sticks, headgear to kind of paint, to create. An aspect of art therapy is what we call art therapist is the third hand. So if someone is creating and they're trying to get something to hold together or stick together or to stand up on its own, the art therapist comes in as that third hand to kind of support, to guide, to encourage them, and just to explore materials, media, the sensory aspects of getting messy, of feeling different textures and temperatures and the vividness of color and moving around in a space. These are opportunities they may not necessarily get in their day-to-day life. if they are physically disabled, or they are kind of limited in terms of their educational environment that they have. They don't have to speak to be able to kind of create and to communicate through the art making process.
Okay, I would like to take a question. That question comes from my teacher, Dr. Seema Parvez, and she says, "Do you feel that art is more effective when used for diagnosis rather than as therapeutic solution? Do you agree?"
That's an interesting question, because using art, there can be a diagnostic quality to it, but it's really hard to say, because you drew a tree with a broken branch, therefore I'm going to diagnose with you as experiencing trauma, or you are depressed, or these types of things. And our therapist needs to be very careful not to kind of make assumptions about the images, and diagnosing the image, or what we call imagicide, or killing the image because we are diagnosing it. A work of art is made just in a moment. It captures a little snippet of time. You don't want to label someone because they did something that looked dark and depressing as a diagnosis. It might inform us, might give us some things to think about. Is this a red flag? Are there things that might indicate, maybe there's some trauma here. Maybe there's a thought disorder that is coming across in the art, that maybe we can get additional testing or consult with our team members to help flesh out that diagnostic aspect of it. So that's kind of how I use that in my clinical work. I'm not going to, hang a diagnosis on a series of, 3 images that they did in a session.
Okay, one more question, which comes from my personal experience being a clinical practitioner. That one very famous approach or therapeutic preference is there on part of different practitioners, which is called eclectic approach. Now it is there that I'm a proponent of CBT or image therapy or DET, RET. But at times I go for an eclectic approach, that I do some psychoeducation, which I take from CBT. I do some diagnosis through imagery. I mean, it is not hypnosis, so to speak, but we do some imagery and induction exercises, which give us some insights for the diagnosis at least. So, do you think that the art therapy can be embedded in other therapeutic interventions, or it has to be taken as a sole, holistic, end-to-end solution?
Well, I think it's a both and. I know that there are practitioners who utilize art therapy in conjunction with dialectical behavioral therapy, because that the structure of that, these kind of the workbooks or these tasks that they use, art therapists have been able to kind of use those prompts, those kind of worksheets, and they can create images that kind of illustrate these different themes and experiences, feelings, ideas, behaviors, and it utilizes another part of their brain, so that they're kind of creating a whole picture, and they can work with the image. So rather than just changing the words or the scenario in terms of this is what happens next in the story, they can illustrate it. They can put in the details and what is the movement, what's going to happen. How is this picture going to change? And that can get really internalized in terms of, as humans, we're very visual learners, and seeing the pictures is going to help us learn, and it's going to help anchor it for us. So that's how I can see it working in that context.
You did talk about something related to how it works when it comes to our cognitive activity, our neurocognitive processes involved when we induce any intervention in the name of art therapy. While going through your presentation, I came across a very interesting slide. I would like to share it over here, which says your brain on art therapy. I would
Yes.
like you to explain that. I'm actually taking that. It's a bit short, I mean, small font. I believe that my audience will just zoom in a bit to understand that. But I would like you to take us through this very interesting slide. Brain at art therapy, a brain on art therapy.
Yes. Well, there's a lot of really exciting research being done on science and art therapy. And this is something that, my students are learning about, and professions are utilizing different neuroscience testing, EKGs, QEEGs, PET scans to look at how the brain is firing and reacting to the creative process, especially around art making. So they're seeing the impact of before and after. So that's some of the background of this. So art, when they're engaged in that process, most people have very positive experiences with that, getting into that kind of creative space, getting into that kind of, as Csikszentmihalyi talks about, flow, that almost mindful, meditative space where we lose sense of time, we're kind of focused. And when we come out of that, it's a very positive experience for us. So we have that. It allows us to become much more self-aware too. It would be so awesome to come to Pakistan and do an in-person presentation and do art with people, because you really get that experience of what you can learn from creating something and looking at it and saying, wow, where did this image come from? And what does it say about me? What did I learn from this creative process? And so often people create this awareness from it. I mean, I'm always amazed with my students, just in the experiential process in class, is when they come out of this, wow, it just changed my perspective on things or my feelings about things. So it's very, very powerful medicine when that happens.
Yeah. I would like to, go on, Craig.
Also, when we're talking about trauma, and so as we know, as Vanderkolk talks about, the body keeps a score, and that trauma is a very sensory experience for us. Anyone who's gone through a significant, traumatic experience, say a bad car accident, you see, the car going through the intersection, you feel the impact, you hear the crunching metal, you smell the gasoline, you taste the blood. Very, very sensory experiences. And with those traumatic experiences, sometimes we don't have the words to articulate what happened, or we don't remember. We don't want to remember because it's so traumatic. We kind of lock that away. And even with young children who have experienced early childhood traumas, because of their verbal capacities, they're not going to have the words to be able to articulate this. So by using art and the visual images, we can kind of get into those parts of the brain, you get into the limbic system and create some pathways, bypassing some of the verbal, cognitive frontal lobe stuff that then they can express those feelings and they can put it out there, and then we get a sense of what's going on. Then they can maybe make the connections to find the words to kind of work through the trauma and anchor that.
Yeah. Okay, we have got a few very interesting questions. One question came later, but it is actually related to what you just said. I'm just putting it up. Tasmira asks, do you think utilizing art therapy for stimulating mental function in older adults with dementia coming from developing countries with less education is better than other therapeutic techniques? I mean, for older adults, to stimulate their mental function, the people leading towards dementia or Alzheimer's.
Mhm.
So, do you think that does it work to keep their neurocognitive functionality intact?
Well, it certainly can help. I mean, there's some great articles and research coming out in the Art Therapy Journal to on
Oh,
working with older adults and working with them who've experienced different levels of dementia. And um, because the art can engage the different part of their brains, it can work on their fine, gross motor skills, because it can allow for opportunities to be kind of social or with others. They're finding that using approaches with different types of media, high contrast media, strong images of black and white so they can see, because their sense of vision can be impaired because of that. Um, it helps them to kind of get engaged, and they may not be kind of talking or sharing about it, but just that the physical manipulation of things um, is kind of bilateral stimulation for them, using both hands or using both sides of the brain. Um, for some, the sensory things that come up just with a scented marker or a crayon, those have, we have those old memories based on those experiences that can engage them. Their short-term memory might not be very strong, but the long-term memory is going to be much more intact. And so the art, the images that are created might trigger some of those long-term memories that they can share, that those can create dialogues with sometimes. Yeah, I've had some great storytelling sessions in terms of what is created in the art process. So I think it's can be very effective um, in developing countries or uh, communities that don't have a lot of resources. It's not about having fancy art materials. It's what do you have at hand? What's natural materials? Go out in the yard, in the community, found objects, things you have laying around the kitchen. All these things can be utilized in a very creative way to engage people.
Because it's very important. This was my next question before I take a couple of interesting questions from the audience. That when it comes to art therapy, it seems that you have to have a very fancy clinic whereby there will be a lot of stuff, a lot of props, two, three assistants with fancy stuff, enabling people to do wonderful artwork. So over here, especially in developing countries like ours, it becomes a little difficult and doable option. So you just clarified that it is not the case. You don't need to. It is not a capital intensive therapy.
Yeah. It's art therapists who are artists, at the core, are very resourceful. I mean, where they find and resource things and build and create, going out in the community. What do people have? Scraps of paper, fabric, yarn, feathers, whatever you can find,
Yeah.
sticks and rocks, and we use it all.
So it means that an art therapist needs to be creative
Yo,
himself or herself to identify that what comes under the orbit of artistic treatment of things. So anything and everything can be treated artistically, can be can be what you can designed artistically. So it is important that we should be clear that it is not a cash intensive therapy.
yes, yeah, I would
Great.
agree with that. Yeah.
Okay, I'll take another interesting question. It is
Mhm.
Sarah Leakey who is asking that from a lay person, but it is a very good question, I believe. At times, anxiety may be so high as to inhibit clients' desire to take part in the process? Can the feedback loop be broken to make the client relaxed enough to participate?
Yes, I believe so. I mean, it's going to depend on the context. If you are doing group therapy and everyone else is kind of engaged in the art making process, sometimes just seeing that, witnessing that, and everyone seeing what people are creating and enjoying, sometimes they will jump in as they get comfortable. Sometimes they may be really hesitant or anxious about, oh, I can't draw, I can't paint, this is too messy. Well, let's try this. Or something, just putting materials out in front of them. Oh, just play around. No expectations. No, you have to make something in order to, be effective. I mean, if you want to talk, we can just talk, or we can talk about metaphors or symbols, or what you had for breakfast. But then, just to reduce that anxiety, give them these opportunities to explore and kind of lead and guide it themselves. I think that's part of building that therapeutic relationship.
Mm-hmm. Another question: how can we increase the effectiveness of art therapy interventions when having therapy sessions online? In my experience, being a psychologist, the activities don't feel too effective when conducting that through video sessions.
No. Well, that is certainly a very contemporary challenge here. But, as I've been seeing what my students are doing with their telehealth interventions, and on the national level and international level, what art therapists and communities are doing in terms of using digital technology, sharing screens and drawing back and forth, doing their own, art process at home, sharing it, uploading it through video or downloads. Those are all kind of part of it. It's not ideal. I mean, I very much like that person-to-person presence of the art making process, but we need to kind of adapt, and we want to reach out to our communities and clients. And this is actually making art therapy more accessible to underserved communities because of this, because they don't have the means to travel, or there's not that many art therapists scattered around in other parts of the country or the world.
Exactly. Okay, we've got another question before I go for my original set of questions. Urva asks, art therapy heals and changes physiology. It is scientifically proven. You did talk about neural pathways and, frontal lobe stuff. So can you share some experiences, some case studies whereby you can recall the effectiveness of your therapeutic intervention in reshaping the neural pathways? Of course, neural pathways, it's not that you did some neuroimaging to
Right.
do some pre and post, but you found some intellectually challenged clients, and art therapy healed them to an extent of being an observable betterment on their part.
Yeah. Well, some of the things that you see, or that I've seen, is you can see the change in the art, and that's the beauty of that product, is that it captures that person. Okay, they first come into your first session, they draw a person where their head is coming apart, and they're standing over a black hole, and the body is visibly falling apart, and you work with them over time, and you maybe re-administer that particular assessment tool or that directive, and you see how the figure has become reintegrated. They're whole. You see a shift in the affect that's expressed, the story, the narrative that goes with it. So that's how art can really be seen, is that change over time. So I've certainly witnessed that with clients. I've seen changes in behavior. where someone coming in very dysregulated, very impulsive, all over the place. And when they get into that creative process and building that relationship, how they get focused, calm, they have a more trusting relationship with you as a therapist. You hear about the changes of behavior at home or at school on the unit. You see just the shift in their affective state. They're coming in very agitated, irritated, and by the time they leave in 50 minutes, they're in a whole different mindset with that. And also their ability to kind of share their experiences, because they're been very guarded and reserved and hesitant about sharing their traumatic experiences. And over time and through the art, those things, the stories come out more, and they can deal with them, cope with it more.
And I believe, and it's my question as well, that if you work on a client with a particular type of art therapy, for instance, if you introduce drawing or painting, but you see that in addition to improvement in painting and drawing, maybe his or her verbal communication improves, the openness to express himself or herself on other continuum of communication improves as well.
Yes, yeah, definitely. Especially in working with a treatment team, where we're getting some insight, some movement in the art, and then they're translating that into maybe their verbal groups that they're doing with their individual therapy or in their family therapy sessions.
Great, great.
Yeah.
Okay, let's take another question. It is Nabila. She's saying art therapy is effective as well for treating adults with severe stress or anxiety, depression. It seems like behavioral activation. That's good for behavior change. I just want to know its effectiveness for cognitive distortions, how it worked to change cognitive distortions into rational one. I mean, now let me tell you, Nabila, I believe that in Pakistan, let me tell you, CBT, cognitive behavioral therapy, is apple of eye for many practitioners, and they do believe in CBT's effectiveness a lot. So I think that what Nabila wants, that while employing art therapeutic interventions, does it improve the cognitive restructuring or cognitive cohesion, which is eventually the ultimate objective of treatment of patient, especially with anxiety, stress, and depression?
Yeah, I think it can be useful with that. And there's a slide here that is the expressive therapies continuum, and it talks about the different types of materials and approaches that elicits these different levels, from a very sensory and kinesthetic level, to affective and perceptual level, and to a cognitive and symbolic level. All right.
I would like to show that slide, Craig. I think it will be interesting if we show that slide and you explain it over here. Let me take that slide over here, and not this one, rather this one.
Before that one, yeah.
Right?
Yes. So this.
So if you can explain this, then it will answer this question.
Yeah. So this is very important in art therapy, this continuum, because it relates to the material and media and how it's going to best fit with the client. So where the client is at. All right. So going back to the cognitive distortion, if you have a client who's kind of stuck on this cognitive level and they have these kind of distortions, working on a cognitive level in the art, like, drawing in something that is kind of rigid and in a kind of that thinking cognitive mode, they might be kind of stuck there. So maybe you want to push the boundary. Let's take them down into a sensory kinesthetic level. Let's play with some clay. Let's do some paint. Okay, you have this distorted thinking, and whatever that image is, or object, or whatever that might be, paint it. What does it look like? What color do you associate with that? What's kind of line or shape or these types of things, so they can kind of see it. All right, in this painting, for example. So then the idea would be to, okay, we want to change this. We want to alter this image to have it a better outcome. How would you shift this? What would you add to it? What would you do to make it different? Doing it at the sensory level. And then you can kind of build up. So what is the feeling associated with it? And then what is the symbols associated with it? And moving it back up to that cognitive level. So you're kind of using images, you're using metaphors to kind of recreate, reconstruct, and shifting from that distorted thinking to kind of get some clarity, to get to that more rational thing. Allow them to kind of problem solve in a creative way. That would be my approach.
Okay, that's really interesting. Now let me get back to our original screen. Maham Mansoor is asking how you see the effectiveness of art therapy with children as their emotions are more ambiguous, and more specifically, its effectiveness with autism and other behavioral disorders. So how does it work in that area?
Okay. Well, certainly with children, they may not have the words for their emotions. But if you give them opportunities to just kind of, what's on your mind, what color or shape would kind of capture, how you're feeling. Now that might help to give them a way of kind of expressing. Okay, instead of saying I'm angry, I say no, I feel like a tiger today. So you can use that. So I bring in like little toys, objects, things that kind of stimulate these kind of conversations as my check-in in my sessions. So that's one way you can do that. With the ASD, the autism spectrum disorder kids or adults, it can be a way of, because there's so many kind of this rigid thinking, the poor ability to pick up on the social cues, and understanding kind of expression and how they express themselves. Using art or kind of mirroring with them or engaging them in an art making process in tandem. Like, I'm going to draw you and you draw me. So it gives them a chance to really focus on somebody's face, to be really attuned to them as you're being attuned to them. And so that can help create a connection between you and someone who's struggling with the autism.
Okay, great. A couple of questions from my side. If we receive some interesting questions, I'll put it on the screen. One is, in Pakistan, at least I know for sure, that our therapists do have their preferences. For instance, if I'm good at CBT, I would like to deploy and employ CBT for as wide range of issues I come across. My preference would remain CBT. And if somebody is more interested in schema-focused therapy or behavioral activation or hypnosis, then they would tend to go for that intervention. Uh, Over there in your college or even in US in general, according to your observation, how this approach of being in the silos, instead of that approach, they create some synergy. For instance, art therapy shakes hands with CBT. Art therapy is also used for behavioral activation. Art therapy gets in sync with humanistic treatment model. So, how does it work there? Is it great in his office and people go to him just to go for art therapy? Or you work in, consultation with other therapists with their specific expertise?
Yeah, so there's different approaches. So some art therapists do have their primary focus is I'm art therapist. People come to me to work on art therapy. Uh, Other art therapists, okay, I'm licensed as a marriage and family therapist, for example, and I do EMDR therapy or brain spotting too. Um, so they may come to me, for this, and I could offer them using art therapy in conjunction to these other therapies. Or I might be the art therapist at a larger mental health clinic, and people are doing their different types of theoretical approaches or their expertise. And they may refer, I've got this kid who would do great in art therapy because I've been working with them trying to do cognitive behavioral, and they're just not, you know, they're not talking, they're not engaging. Let's try a different approach. So I see that happen a lot, that kind of cross referencing of that. And there certainly are some, agencies, systems, parts of the country where, art therapy, oh, that's just, poof. Yeah, just, what's the value? That's just arts and crafts, and
We,
it's not
we
real
do
science.
more we do more serious things, and this kind of feedback is there that CBT or RET, they are more serious stuff. They are more intense. They are more theoretically more convincing as
Right,
compared
that
to art
evidence-based
therapy.
practice.
Fine. Okay. Now, before I conclude, Craig, would you like to educate us a bit more about the learning opportunities, especially for the students and practitioners here in Pakistan? If they want to learn and enhance their skills, particularly in art therapy, what are the options out there through
Yeah.
distance learning programs, certain certificate programs, diplomas, or even on campus once this pandemic fiasco is over? So at least our graduates who are students, they can plan their careers in times to come if they go for specialization. So, what opportunities your college or other institutions in US offer when it comes to art therapy specifically?
Okay. Well, before I delve into that, I want to just kind of clarify that, that art therapy isn't just a technique that you give someone a box of crayons and you're doing art in your sessions, and that's art therapy. That is not it. It is a really specific profession that practitioners need to have a lot of specific training, a strong art background in order to do this. So it's going to be important that just taking a workshop, or a weekend experiential with an art therapist on some techniques, that's not going to give you everything that you need to be doing art therapy in an ethical way. So, and I know people are very hungry for this. They want techniques. They want, to how can I utilize art in therapy, which you certainly can. Just be mindful. Don't call it art therapy if you're not trained as an art therapist. So there are growing opportunities with some online distance programs. Some colleges have fully online programs. Some are, residentially based, like Adler has traditionally been an on-campus experience because I feel that's a very valuable learning. But might be moving into areas of hybrid
Yeah.
experience where you might do a residency to take art therapy specific courses and having some supervision and guidance with an art therapist locally, and then go back and maybe do additional courses via distance and getting more experiences like that. So that could be, I think that's a growing edge of our profession. There certainly, we offer a Postmasters certificate in art therapy. So this would be someone who, has the qualifications in terms of they have a master's degree in a related field, psychology, social work, these types of areas. They have some art background experience with that, and then they could come and do a postmaster's degree, or a certificate, and then having the experience, the 700 hours of experience and supervision to get credentialed in the U.S. anyway, or at least certainly have a good experience to take these skills elsewhere.
So it should be clear for the students that it is not a technique which they would learn. Like I'm actually referring it in particular that like EMDR or hypnosis or some course in NLP, neuro-linguistic programming, and then they think that once they attended this 6 days or 8 days program, so now they are good to go ahead as a practitioner.
Right. Yeah. That is not art therapy.
That's art therapist. That's very, very clear. I think it is so good, so far, so good. And anything else, Craig, you want to convey to the audience here in Pakistan? You want to share anything, particularly, as your experience is enormous when it comes to teaching and handling students with a lot of aspirations and expectations to be a very good therapist, to be a very good practitioner. So I would like you to comment in general what makes a student of psychology, or even at the end of the day, a graduate, psychology graduate, a good therapist? What kind of personal characteristics and traits they should be focusing on to be an effective therapist in general and to be an art therapist in particular?
All right. So I think the biggest thing I would say is self-care. How do you take care of yourself? How are you managing the stressors, the demands of being a student and being in relationships and working on the side, dealing with challenging clients, dealing with, crazy systems which are more dysfunctional than the clients that they serve? That is so key to taking care of yourself, because you can't take care of others or help others if you can't really help yourself. So whatever your strategies are in terms of eating or exercise, spirituality, yoga, art making, have a clear self-care strategy. And also to really know yourself. What are your blind spots? What are the things? Why are you impelled to want to be a therapist to help others? What is driving you for this? Is it to, I'm going to fix myself by fixing others? Or, where is that coming from? To have an understanding of who you are in this context of being a therapist, because it's going to come out in your challenging client relationships. So those are very key. And if you're an art therapist, keep making art. If you are just a non-art therapist, find your creative outlet, whether it's dancing, singing, writing, gardening, these types of things. Everyone has a creative outlet.
Even baking and cooking. I have seen
Absolutely.
people baking and cooking, and they come up with so much artistic, euphoria when it is time for them to go to the kitchen and to make some cakes or some
Right.
cooking. So I think that it is not limited to any particular aspect.
Absolutely. It's how we can contribute to others, how we can find significance, how we can, be engaged and give to others in a creative way. So very, very important, no matter what that is.
Great. On this very happy, encouraging note, I would thank you, Mr. Craig. It's really it is pleasure to have you, to know you, and to introduce you to the audience, especially comprising of the psychology graduates and students and practitioners. And I believe that our today's session will leave them with an appetizer. Will serve as an appetizer, and with leave them with more appetite towards learning art therapy and then practicing it. Obviously, again, not taking it as some quick technique or a quick fix technique. Rather, it is a paradigm, it is a school of thought. Very well established constructs actually enable therapists to practice more effectively. So, if you want to dwell into it, you have to dwell into it fully, holistically.
Yeah. Yes.
So thank you so very much for your time, and have a wonderful weekend. I believe it is the first half of the day over there, and I wish you to stay safe and thrive in your professional endeavors. We'll be in touch, and we would like our Pakistani students to learn more from you in times to come.
Yeah. Well, thank you so much. I would love to share and connect, and may our paths cross again in the near future.
Thank you very much. Thank you, Craig. Have a nice day ahead.
Our pleasure.